Hawaii looks pretty good right now when it's about 12 degrees outside our windows. But
absolutely.
Let's get to our top story. Brand new Fox polls showing support for Obamacare dropping to new lows. Good morning to you on this Friday. I'm John Scott.
And I'm Uma Pemaraju, in today for Jenna Lee. As approval for Obamacare drops, HHS Secretary Kathleen Sebelius is on the road today promoting the new law as a key White House health care official resigns. Obamacare advisor Chris Jennings leaving after only 6 months on the job. The White House brought him on last summer to deal with the health care rollout. Now he's stepping down after a health scare put him in the hospital. Chief White House correspondent Ed Henry is joining us now live with more from the White House. Ed, good to see you.
Good to see you, Uma. The bottom line is White House officials here say that there were family issues, as you suggested, that Chris Jennings had to attend to in addition to that health scare, and so that's why he's stepping down. What's important about this is that he was somebody who had brought a lot of experience to the table because he had served way back in the Clinton administration on health care issues as well, and so obviously had been through many battles on Capitol Hill between the Clinton White House and Republicans on the Hill, now between the Obama White House and Republicans on the Hill. And let's face it, there is still a big battle ahead in terms of implementing this law. The latest Fox poll out last night shows the law reaching new lows in terms of popularity on the question of whether you favor or oppose it. Now 36% favoring, 59% opposing. You can see that favoring is down 4 points from June of last year. Then on the president's handling of health care, 38% approve, 59% disapprove. That is why it's still a big challenge ahead for the president implementing this law. But they believe inside the White House that they have a good story to tell, that they're turning the corner on the website, but also, more importantly, they're increasing the enrollment numbers. So they believe they're getting this law on its feet. Uma.
Well, Ed, the President's State of the Union speech is coming up next week. How big of a role will health care play in that State of the Union speech that we're expecting?
Important for it's important for a number of reasons, Uma. I mean, first of all, obviously, he does have to try and make the case that this law is stabilizing, but also has to turn the page a bit from it to try and focus on immigration reform and the economy and some of his other priorities in the second term. Interesting, Vice President Biden was out yesterday making the case for the law, while Speaker John Boehner was actually on with Jay Leno saying this law still needs to be scaled back. Take a listen.
Somehow our opposition thought somehow this health care thing, it's not a basic human right.
We think Obamacare is bad for the country. We think we shouldn't spend more than what we bring in. We think the president's ignoring the laws. It's all a fight over tactics. It's not over what our goals are.
Bottom line, a State of the Union next week. The president is going to be not just making the case for health care, but making the case for why he's still relevant in pushing his agenda, because he's getting closer and closer, obviously, to becoming a lame duck. Uma.
Ed Henry, great to see you from the White House. Thank you very much for that update.
Good to see you.
And for more on those Fox polls showing support for Obamacare reaching a record low, let's bring in Monica Crowley, author and Fox News contributor. Also, Basil Smikle, who is a Democratic political consultant. As we are speaking, Monica, the Secretary of Health and Human Services, Kathleen Sebelius, is telling an audience in Jacksonville, Florida, that the website, the private websites, the private insurance plans for Obamacare have registered about 3 million participants as of now, 800,000 in January. Originally, the published White House goal was 4.3 million by this point in time. Does that mean they are catching up with the notion of success?
Well, if the numbers are accurate, John, then perhaps, but we still don't know how accurate these numbers are. Even the White House's administration can't tell you how accurate they are, because when she talks about signups, does that mean people who have actually enrolled in Obamacare by paying the first month's premium? We also don't really know the demographic mix. They're giving us some estimates, but again, they need the young and healthies to sign up, and they're telling us that about 25 to 28% of those signing up are in that age group. That's not nearly enough to uphold this thing and make it work. And again, how many of them have actually enrolled to the point where they're paying the first month's premium? We have yet to see those numbers.
Basil, let me call up again the poll numbers that Ed Henry was just showing us from the White House regarding the president's handling of health care. Only 38% say they approve, 59% disapprove. From your perch there as a Democratic political consultant, how do you fix that?
Well, you know, the president sort of derided the fact that people were talking about the bad messaging on this bill. But the fact of the matter is that the messaging matters. To be honest with you, I support the bill, but I'm not sure that the president and the Democrats can get there in this 2014 election year in terms of the messaging. I'm hoping that they will. And Uma raised the question earlier about the State of the Union address. I think that has to be the beginning of a strong rollout of better messaging on this bill. The concern, however, is are the president's coattails strong enough, again, in this election year? But I think you will see, and I hope you will see, quite frankly, that the State of the Union speech, should he talk significantly about this bill, that it's the beginning of a larger push, similar to what you saw when he was actually trying to get the bill passed in the first place.
We asked a kind of a complicated set of questions, Monica, but I want to put the numbers on the screen. Asked whether voters think the Obamacare law will increase or decrease something. Decrease your taxes, 63% say it'll increase them. Your health insurance costs, 62% think it'll increase. Federal deficit, 56% think the deficit will be increased as a result of Obamacare. Quality of life, only 36%, roughly 1 in 3, are thinking that Obamacare will improve their quality of life. And quality of health care, this is the really astounding number to me, only 19% in our Fox News poll think that health care is going to be improved as a result of Obamacare. Those are, you know, that's a heavy lift for the White House and anybody involved to try to turn around.
Yeah, and Basil was talking about the messaging on Obamacare, and I've heard the White House say, look, we just have to get our message out. They have had 4 to 5 years to get their message out on Obamacare, along with the leftist media that has been promoting this thing, Hollywood and so on. All they've been doing is messaging. It's not a public relations problem. It's not a messaging problem. This is a policy and reality problem. And the numbers you just put up there, John, really tell the tale. This Obamacare, socialized medicine, was never popular, never, especially when it was, particularly rather when it was just a theoretical proposition. Now that it's an actual reality and people are seeing the rise in taxes, the rise in their health care costs, their premiums, their deductibles, loss of insurance, now that they're seeing a less access to their doctors, they're seeing that this whole thing is going to cost more to the country as a whole and drive up the deficit and the debt. They are now really opposing it in stronger numbers than we have ever seen. So now that it's a reality and directly affecting people's lives, you're seeing these numbers get worse for the president, worse for the law, and worse for the left overall, because socialized medicine is the crown jewel of the welfare state.
Do you dispute any of that, Basil?
Well, I don't know if I would go so far as to call it socialized medicine, but I will say this. What I will concede is that the fear in the long term is that we're getting to a system with healthcare that is, interestingly enough, both more nationalized and more privatized. And what I mean by that is you have a lot more government expenditure because of more people getting on Medicare and Medicaid, especially with the expansion of Medicaid in some states. I think ultimately that's not a bad thing, but at the same time, you also have a lot more insurance companies now offering health care to people who didn't have it before, and the concern is that the costs are going to rise on because of both the government intervention and because of the increase in a number of private companies that are providing health care. Well, so I think in the long term, the costs are something that we need to take a look at. But I'm still confident that a lot of the young people that will be able to, that should sign up for this bill, will be able to, especially that there are 2 Republican members of Congress that are trying to fix the bill by offering tax incentives. Maybe that helps.
We'll see. It's going to be a potent political issue, it would seem, come November. Monica Crowley, Basil Smikle, thank you both.
Thank you, John.